Madam President, I have high hopes that the Senate will soon vote to enact the Drug Quality and Security Act, so-called compounding and trace and track bill. This legislation helps ensure the safety of compounded drug products, and it also secures the pharmaceutical supply chain. I'm pleased to report that it's the product of excellent bipartisan collaboration on the Health, Education, Labor, and Pensions Committee, where I worked very closely with our ranking member and my good friend, Senator Lamar Alexander. It also reflects productive conversations with our colleagues in the House, including Chairman Upton and Ranking Member Waxman of the House Energy and Commerce Committee. The House passed this bill on September 28th, and now it's our turn to do our part. Madam President, Title I of the bill addresses drug compounding. And this is basically what happened here just over a year ago when we were shocked to learn one of the worst public health crises that we have experienced in recent years. It was a meningitis outbreak that claimed the lives of 64 Americans, sickened 751 people in 20 states. And you can see the hardest hit were the home state of Senator Alexander, 153, Indiana 93, Michigan 264, Virginia 54, New Jersey 51, Florida 25, but 20 states. And a lot of people got really, really sick. And I'll be talking just in a minute about some of those that still linger today. Well, what this outbreak did is it brought attention to the legal and regulatory gaps that allowed owners and managers at the New England Compounding Center to disregard basic procedures to ensure that the products they were manufacturing were sterile and safe. And this gross negligence had heartbreaking consequences for families nationwide. Patients that were sickened, patients like Karina Baxter, whose 3 adult children, Anita, Andrew, and Brian, lost their mother, and whose community lost a dedicated math teacher and tutor when she died of this meningitis outbreak, age 56. Dawn Elliott from Indiana, who used to scuba dive in her free time but is now in unrelenting pain, has had to give up her job and deplete her savings. Evelyn Bates from Michigan, who was diagnosed last November, continues to struggle with tremendous pain every day, and whose daughter had to quit her job to take care of her. Dennis Blatt, who lives on the West Virginia-Ohio border with his wife and 3 young children. They've had to watch their father go from being an involved parent with a steady income to a man whose daily life feels, in his own words, like a slow, torturous death. So these meningitis outbreaks linger on. It always also has a kind of a personal sensitivity to me. My older brother, some years ago, went deaf at a very young age because of meningitis. So it has lingering effects for a lifetime. So that's what happened a little over a year ago. Although we know that it wasn't just an isolated incident, it was the biggest. But this chart, which is kind of hard to read, it just shows it going clear back to 2001. We've had 4, 11, 64, 18. In other words, every year we've had some results that we've noted from compounding that made people sick or caused deaths. So this has been ongoing for a long time. It's just that what happened a little over a year ago in Tennessee and these other states was sort of the dam broke. It just beyond all comprehension how many people got sick and died. So again, in response to these facts, beginning last year, Senator Alexander and I convened the members of the HELP Committee with assistance from Senators Franken and Senator Roberts in an effort to identify the gaps in current policy, to solicit stakeholder views, craft bipartisan legislation to better ensure the quality of compounded drug products. We formally solicited 3 rounds of public comment, and we held 2 public hearings before marking up the bill last May. Then over the summer, we worked with our colleagues in the House to craft a package with strong bipartisan and bicameral support. Now, the compounding provisions in this bill are an unqualified step forward from current law and practice. Basically, what this bill does in the compounding in Title I, I'll get to Title II in a second, it distinguishes compounders engaged in traditional pharmacy practice from those making large volumes of compounded drugs without individual prescriptions. So those who wish to remain in traditional compounding that we might know where they're making small amounts for a certain type of illness or for a certain hospital, that type of thing, they stay under the state boards of pharmacy as they are in current law. Now, an entity that neither stays within those limits of traditional pharmacy compounding nor registers as an outsourcing facility, if they don't want to do one of those two, then they are illegally selling unapproved drugs. So that's what it does. It distinguishes. It defines the Food and Drug Administration's role in oversight of these outsourcing facilities. They'll be subject to FDA oversight in much the same way as traditional drug manufacturers are today. FDA will know who these outsourcers are and what they are making. We serve adverse event reports about compounded drugs and have authority and resources to conduct risk-based inspections. In other words, the lines of responsibility are more clearly defined. I give much credit to my friend from Tennessee for continually, that's about raising the flag. Who has the flag? Who was responsible? Because we found out there was sort of a confusing mess for everybody about who was responsible and who wasn't. And thanks to Senator Alexander, we have cleared that up in this bill. The bill offers providers and patients better information about compounded drugs. It directs FDA to make a list of FDA-regulated outsourcing facilities that will be available on their website. Requires detailed labeling of compounded drugs, prohibits false and misleading advertising, and finally, it clarifies current federal law regarding the pharmacy compounding. It strikes the unconstitutional provisions that were in current law, which kind of led to a lot of this mess. We had different courts in different parts of the country interpreting it differently. So anyway, it resolves that patchwork, applies a uniform standard nationwide. Now that's Title I. Now Title II of the bill is the track and trace provisions. And basically, this committee, again, working in a bipartisan fashion a little over a year ago, you may remember we brought an FDA user bill to the floor. It passed, signed by the president. That cleared up the upstream part of where drugs come from. In other words, from the plant derivation to the distilling of the product to everything, all the way up to the manufacturer. So now we have a much better regulation, clearer pictures of drugs that come from China and Indonesia and U.S., no matter where they come from, up to the manufacturing standpoint. What we didn't have at that time was a real understanding of or an agreement on how to control it from the manufacturer down to the consumer. So our committee got involved in this, and again, Senator Alexander helping to lead the way with Senator Bennett and Senator Burr for almost 2 years. Working on this issue. And so now we have this system, and I think this chart kind of shows it. As I said, everything up to the manufacturer we took care of in the FDA user bill. Now this bill takes care of everything from the manufacturer down to the dispenser, that is, down to the consumer. So no matter where the drug goes, whether it goes directly from a manufacturer to a wholesaler to a dispenser, or whether it goes from here to a secondary wholesaler, another secondary wholesaler, another secondary wholesaler. We found that in this country there's a patchwork, there's a kind of all kinds of different ways for a drug to get from a manufacturer down to a consumer. So Senator Burr, Senator Bennett, Senator Alexander, our staffs worked together on this to get this picture put together and to have a track and trace so that we can track the drug. No matter how it goes, we can track it and we can trace it. Now that will come into being over 10 years with electronic interoperable product tracing. Now you might say, well, 10 years is a long time. I would point out the House had 27 years. They agreed with us and made it 10 years, but that's for electronic interoperability. Beginning in January of 2015, yes, January of 2015, they'll have to start paper tracing. So there'll be paperwork, but it'll take 10 years to get it all at a unit level and all electronically and interoperable. And you can understand it takes a long time. Different manufacturers, different suppliers have different systems, and so this will be worked in over that period of time. But we will have traceable after January of 2015. It establishes nationwide drug serial numbers and requires a pathway to unit-level tracing, as I said, strengthens licensure requirements for wholesale distributors and third-party logistics providers. And again, there was a lot of a hodgepodge of different kinds of licensures for wholesalers, and we strengthened that up. And then we, as I said, we have a nationwide serial number established for that, and that will come 4 years after the date of enactment that will serialize drugs in a consistent way across the country. So again, this is a bill that many might say is long overdue, but better late than never. I'm sorry it took a terrible calamity like the outbreak of meningitis to get us to really focus on this and move it, but it did. And I think this, again, is a good example, again, of where the Congress can work in a bipartisan, bicameral fashion. I met with Chairman Upton on the House side earlier this year, talking about a pathway of getting this done. In fact, what we're working on here is the House bill. The House passed it by unanimous consent. And if you've been reading much about the House, you know they don't do a lot by unanimous consent in the House. That just shows you how much work went into the bill and how it was done in a true bipartisan, bicameral fashion. So the House passed it by unanimous consent. And now we have it here, and I dare say, but for a senator, one person, we probably would have passed it by unanimous consent here. I haven't found anyone that's opposed to this bill and who doesn't recognize that it's well supported. We have a plethora of people and industry and consumer support. American Pharmacists Association, American Public Health Association, the Biotechnology Industrial Organization, plus a lot of the big pharmaceutical manufacturers, some of the small pharmaceutical manufacturers. Everyone recognizes that we need a better system to clearly outline who the traditional compounders are and who the outsourcers are, give FDA clear-cut authority over one segment, give the states a clear-cut authority over the other segment. As I said, if you don't fall into one of those two, you're outside the law. So it really does clear it up, and this will ensure the quality and safety of the drugs that patients rely on. I'm hopeful that we have a cloture vote later today. I'm hopeful we'll have a good, strong vote on cloture on this bill. As I said, I can honestly say, standing here, I have not heard one senator from either side of the aisle tell me or inform my staff that they were opposed to the bill, as such, the bill. So, again, I hope we have a strong vote, and I'm going to yield the floor and, again, pay my compliments and my highest respect to Senator Alexander for his leadership on this. His state was hit very hard by this. I know he's very sensitive to that, and I know just from my talks with him, I know that it pained him a great deal to see so much suffering and deaths in his own state. And Senator Alexander got on top of this and pulled us all together and basically said, we got to get it done. So Senator Alexander, thank you very much. I yield the floor.